Now let's take a closer look at hepatitis C. The hepatitis C virus, otherwise known as HCV, reproduces in the liver, causing inflammation and possibly cirrhosis, liver failure, or liver cancer, much like the hepatitis B virus does. However, HCV is a different virus with its own traits. A person may be infected and have no signs or symptoms, and they can live with the virus for decades without even knowing it while the virus does damage to their liver. About 80% of the people exposed develop a chronic infection, and only about 20% are actually able to clear the virus by naturally building immunity. There are about 3.2 million people in the U.S. infected with HCV, with about 17,000 new cases yearly. Deaths from chronic disease each year total approximately 12,000. Symptoms are not reliable, and they're not a great way to detect HCV. You must have a proper test to be sure. Some of the symptoms include yellow or jaundiced skin, yellowing of the eyes, tiredness, loss of appetite, nausea, dark urine, joint pain, abdominal discomfort, sometimes severe, fever, and clay-colored stools. Unlike HIV or HBV, hepatitis C is spread primarily through contact with the blood of an infected person through needles. Hepatitis C is most commonly spread by tattoos or piercings performed with unsterilized equipment. The sharing of needles for injecting drug use, which is currently the most common means of HCV transmission in the United States. Receipt of donated blood, blood products, and organs, once a common means of transmission, but now are rare in the United States since blood screening became available in 1992. Birth to a hepatitis C infected mother, needle stick injuries in healthcare settings, although this is a low percentage of the HCV infection. HCV can also be spread less frequently through sexual intercourse with an HCV-infected person or sharing personal items contaminated with infectious blood, such as razors or a toothbrush. HIV-infected people face a much greater risk of infection of hepatitis C. There's no evidence of hepatitis C virus transmission from food handlers, teachers, or other service providers in the absence of actual blood-to-blood contact. Like HIV and hepatitis B, it's not spread by casual contact like handshaking, hugging, doorknobs, using the same equipment, or public items like toilets and water fountains. Traditionally, there's been no cure for hepatitis C virus. However, in recent years, new drugs have made big improvements in the way hepatitis C virus is treated. Some studies have had up to 90% of the infected people cured by taking a combination of new drugs approved by the FDA. The downside is that these drugs are very expensive and they cost tens of thousands of dollars for the required treatment. There is still no vaccine available for HCV.